Dr. Dibyendu Kumar Ray, a consultant neurosurgeon at AMRI Hospital, Salt Lake, Kolkata. Amongst all the patients who come to us, many of them are patients of epilepsy who look for way out from the long-term high dose and multiple medications that they need to take. Many of them come with some misconceptions about epilepsy, and I believe that it is very important to clear the misconceptions that they have about epilepsy. What is epilepsy, first of all? Epilepsy is a neurological disorder which is marked by sudden or recurrent episodes of sensory disturbances, loss of consciousness, convulsions, which are associated with abnormal electrical activity of the brain. It is unfortunate that despite all the advances that we have made, even today there are many misconceptions about epilepsy in the general population. Epilepsy is not a very rare disorder. It affects about 5 crore people worldwide. That's about 50 million people. In India, which has a population of about 1 billion, we believe that there are 6 to 10 million people with epilepsy. Many people consider epilepsy to be a mental illness. They say they abnormal, have some mental developmental disorder. The majority of the people with seizures or epilepsy do not have mental health issues, and though they may have some mood problems like anxiety or depression, but we cannot equate people with epilepsy having some mental health issues with mental health issues. People with epilepsy, are they crazy, violent? No, they are not. None of them are violent. When an epileptic attack or a seizure occurs, they may throw their arms and legs in any direction haphazardly, but they are not violent. During seizures, they may not respond to questions, may speak some unintelligible words or sounds, may repeat a word or phrase, but it's not that there is something else is wrong with them, because they return to normalcy once the attack is over. Children with epilepsy are, if we can control the epileptic seizures in good time, they do not have any intelligence or cognitive issues, and those children should be encouraged by parents and teachers to attend normal school and complete their education, whatever they want to, provided they take their due medications and visit the doctor once every 3 months or so, so that the medications are changed, the dosage is changed according to their weight. Epilepsy is not a divine intervention. It does not spread by any contagious methods, and obviously using of methods like smelling shoes and all or placing a metal key in somebody's hand does not cure or relieve an epileptic attack. Medications today are very effective in treating epilepsy, and sometimes if adequate dosage is used, one medication is good enough to control epilepsy in most patients. We may require up to 3 medications to control seizures in some patients, but usually we do not require more than 3, and more than 3 medications usually do not add much benefit to seizure control. Often, we have patients whose parents ask, is marriage a cure for epilepsy? No, it's not. It doesn't cure epilepsy. But a person with epilepsy can get married provided the seizures are controlled and lead a normal life. So, what are the methods of treating epilepsy? Amongst the medications we have several lines of drugs which are important in treating epilepsy, and the other thing that we have is we have first line drugs, second line drugs, the newer drugs, the older drugs. We have drugs for several types of epilepsy. But in case of refractory epilepsy, where seizures are not adequately controlled with drugs for treated, even when the patient has been treated by a qualified neurologist for a period of 2 years, then we can think of surgical options for epilepsy. For surgery, we need to get video EEG done for the patient. We need high definition MRI scans, and often we may also need depth electrode or surface electrode mapping of the brain, which will provide us an adequate area of the focal, idea of the area of epilepsy, because we want to correlate whether the area we see on an MRI scan actually is the epileptogenic focus. So, what I would like to say is, if a person has epilepsy, he should not be worried. There are adequate drugs for it, and if drugs fail, we have adequate number of gadgets and surgical repertoire to take care of patients with refractory epilepsy. One needs to be pragmatic and open-minded and have an optimistic outlook to have adequate, treatment protocol or regime planned according to his or her individual preferences for management of the epileptic condition. Several times it has been asked about which patients are the candidates for epilepsy surgery. I must state categorically that surgery may be an option for people with epilepsy whose seizures are disabling and are not controlled by medication, or when the side effects of the medications are severe and greatly affect the person's quality of life. What sort of surgery is available for epilepsy? That's another question. So grossly, we have 3 types of surgical approaches to epilepsy patients. One is surgery to remove the area of the brain producing seizures. This, under this heading comes surgeries like lesionectomy and selective amygdalohippocamectomy. Then we have surgery to interrupt the nerve pathways through which seizure impulses spread in the brain. We have surgeries like multiple subpile transection and callosotomy for that, and we can have a device implant to treat epilepsy which we have a motor cortex implant which senses an epileptogenic impulse and then literally zaps that area of the brain so that seizures do not occur. Grossly, we have several ways of deciding what surgery has to be done. Amongst them, it includes, as I talked to you about, EEG. Then we have neuroimaging with PET scan, SPECT scan, MRI scans, and if possible a magnetic encephalogram. Then we have neuropsychological testing. We have intracarotid ammobarbital test for the WADA test, and then we have electrocorticography by implantation of surface or depth electrodes, and the surgery that we have has two aims. One is definitive, which means a reduction of 70 to 90% of the seizures, and palliative, by which we aim to decrease seizure frequency, and in which we disrupt the pathways that cause impulse generation, impulse propagation in the brain. If any of you feel that you're candidates for epilepsy surgery, it would be great if you can contact the contact details mentioned below, and our office will get in touch with you to provide other details that you may require.